massage nerds. Today I am bringing you the hamstrings. I'm going to show you a little bit of anatomy, physiology, some techniques, and also how to work the sacrotuberous ligament. So let's start with some people that you might want to work on if their hamstrings are tight. It's usually runners, even people that are sedentary because they start shortening and cramping up. Some people with plantar fasciitis, it'll affect the hamstrings. People with low back pain, it'll affect the hamstrings, especially because the sacrotuberal ligament attaches, connects with the hamstrings right here at the ischial tuberosity. So let's start with that. So this is the ischial tuberosity. That's your ischium. That's the bone that you sit on. And the sacrotuberous ligament, it originates from the sacrum and the ilium, and it goes down and it inserts right here. And this is also the origin of the hamstrings. So you can see how it's connected. So if the hamstrings are really tight, they're going to pull on that low back. So it's very important that you also work the sacrotuberous ligament. So let's start with the biceps femoris. Biceps femoris means it has two heads. The origin of the long head is at the ischial tuberosity and comes down and it inserts at the head of the fibula. The fibula is your lateral leg bone. And the short head originates on the linea aspera right here of the femur, and it also inserts at the head of the fibula. And then you have the semimembranosus, which is the green one, originating at the ischial tuberosity too, and then it comes down and it's pretty wide. It inserts at the posterior condyle of the tibia. Fibula is on the lateral side, tibia is on the medial side. That's your shin bone. And then you have your semitendinosus. Semitendinosus is the one with the longest tendon of the three. Also originates at the ischial tuberosity, comes down, that's the pink one, and inserts, has a long tendon, and it inserts at the pes anserinus, which is on the tibial side. The pes anserinus is where three main muscles insert. The gracilis, which is one of the adductors, the sartorius, and the semitendinosus. So you have three muscles that insert right here. So you want to make sure and work this out gently, circular motions. But that's the anatomy of the hamstring. So let's start. After you've warmed it up, you want to do your petrissage and you want to do your effleurage, and you want to start sometimes with a little lighter, the pin and stretch, and the some of the movements that I want to show you is like, this is a really good one. This will be a passive action. So she's not going to do anything. I'm going to do the movement. You get your soft fist. You hold with your left hand, and then with your right hand, you make a soft fist, and then just glide up all the way up to the ischial tuberosity. You might want to tuck in this thumb so that you're not doing this. So you want to tuck in the thumb like this or like this. Make a soft fist, and go ahead and flex and bend the knee as you go up. And like I said, unfortunately, I'm not able to do this with oil because it'll smear everything. But you get the idea. And I'm using my legs and pushing with my legs up and down. Right now, I'm on the lateral side because the lateral side is the the biceps femoris is on the lateral side. So you might want to go up a few times, with a biceps femoris is. And then if you want to go a little bit more medial, you get the semimembranosus and the semitendinosus. So you want to just do this a passive movement. She's not using any of her muscles. I'm just trying to get them to relax a little bit. And you might want to, with your knuckles, just kind of, work on the origins there. Not using too much pressure, but a little bit of pressure to work on the origins, because a lot of times that's where they have trigger points. Now, I'm going to do an active motion where she's going to offer resistance. She's going to push against my left hand, and I'm going to do a pin and stretch. So I'm going to pin the the origin, so she's going to push against my leg. So push, 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 push. Okay. And then relax. And then you move down 1 inch and push, push, pin and stretch, and then relax. And then go down again 1 inch, push, push, push. Okay. So I'm engaging the muscles first passively, then actively, so you can get them to, to activate. So push again. And this is a pin, like a pin and stretch. Push against my leg, against my hand, and just move down. And push against, there you go. And all the way down to the insertion of the biceps femoris, and then you do the same thing more medially. Push against my hand, there you go. More medially against my hand, she pushes, so I can pin and stretch. Okay, these are more medial. The biceps femoris is more lateral. So you continue down, until you finish all the way down. Another one that I like to do while I'm showing this technique is you're gonna hold again their ankle with your left leg, and this is what I'm gonna do. I'm gonna go cross fiber. Remember, a lot of times the muscles, just with a fascia, it's like glue and it connects them. So I want to go cross fiber and try to separate some of these muscles. So this is what I'm going to do, is I'm gonna sink down, and I'm just going to get really short here on the table and move back and forth, cross fiber all the way up and down while I am moving with my left hand. So I'm pulling and then pushing, pulling towards me, and then going medially with my hand. I'm going medial and lateral, going cross fiber all the way up, and I can do this fast or slow, but I want to make sure the knee is in, but you can move the leg in and out, in, leg out. So while the leg is going in, you're pulling laterally. And then when the leg is going out, you're pushing medially. So this is really separating the fibers here of the hamstrings. And this is, like I said, you want to activate some of those muscles. So now another one that you can do is, I like to do the piggyback fingers, where I just glide all the way up. You want to treat the insertions very slowly, very gently, because a lot of times these are very sore. So you can also do, some petrissage here, and also lift and separate the fibers here. You can lift and separate the fibers. You want to do some cross friction, especially at the ischial tuberosity where all the origins are. You can do some cross friction here, separating the fibers. So this is just a little bit more specific work. Remember, you don't put pressure on the popliteal. And also, you can do some circular motions here all the way, like finding, push against my leg, against my forearm, like push against my forearm. Okay, when she's doing that, okay, relax. I can tell the edges because she's engaging the biceps femoris and the semitendinosus and membranosus, so I can tell where the edge of it is, because the adductors are right here. The adductors connect right here. And this would be the vastus lateralis and the iliotibial band on the lateral side. So you want to go up, treating, and this is a good way to find trigger points. You can find where the tension of the muscle is. So let me see, there's another technique I wanted to show you. So let me see, 1, 2, 3. Oh, another one is, and I have the sheet pulled in all the way up over here. So this is another one where you can get their leg off the table, and I'm going to push with my knee, my left knee, while I can go, and work. So I can go the soft fist while I'm pushing with my knee up her, just engaging the hamstrings. But this is what I'm doing with my leg. I'm pushing right here. So I can do that. But I also like to do, while I'm doing that, you know, just pushing up all the way up, treating the hamstring. Or I can do it just with one, you know, one long stroke. And then with this one. So this is another technique that you can use, like to get the leg off the table. One of my favorite techniques, and I've shown this in other videos, is when you do I call this the frog style. You bend their knee and it comes up, and you pull the sheet at the same time. And the client can hold the sheet if they want to feel better. But this really exposes the ischial tuberosity, and you can go cross fiber right here. This is a great way to go cross fiber and just really work the hamstrings. And you can go to the other side of the table too and do it from that side. So this is another way that you can do the ocean waves right here. Just go cross fiber. This is an excellent way to treat the hamstrings right here. And I'm going to go around and show you how to treat from the contralateral. But this is an excellent way to really relax the muscles. And I'm pushing now opposite here of the ischial tuberosity, trying to release the sacrotuberous ligament. And you can work over the sheet also. You don't have to expose if your client doesn't feel comfortable. You can work over the sheet. But as you can see, the sacrotuberous ligament, you know, it actually originates from the ilium. So all of this is the sacrotuberous ligament. And if this is tight, it's going to pull on the low back. A lot of people think that they have low back pain coming from the lumbar area, but it could also be coming from your, you know, from your hamstrings. So you want to make sure and do, you know, all the way across from work the ischial tuberosity. You can do some palmar compressions here just to release that sacrotuberous ligament. And you can do some pin and stretch here where I'm pulling back with my left hand and then pushing forward. Or I can pin the sacrotuberous ligament with my left hand and then just push with my right hand. And again, from this side, you can work the hamstrings. So there's different ways you can go contralateral, same side of the table. And I think and like I said, at the end, you know, you want to go back and do some more specific work. The trigger points are usually here, and they refer down even to the back of the knee. Some people, you know, people have pain in the knee, and it could be coming from the hamstring. So you want to make sure and treat the bellies, the origins, and if you need to hold the trigger point for, you know, up to 30 to 90 seconds and have them breathe while you do that. And just at the end, make sure you always make them feel good, you know, do some nerve ending strokes and help them relax, because this is intense work, especially for people. I've seen this a lot in cyclists, you know, people that cycle, soccer players, and also people that are sedentary, people that have knee pain, heel pain, back pain. So make sure you treat the hamstrings, the quads, and the adductors. Check out those other videos. Now I'm going to show you the supine position. Okay, so now she's in the supine position, and from here you can actually treat, remember this is the tibial side, the semitendinosus attaches right here on the medial condyle of the tibia, and then the biceps femoris inserts at the head of the fibula. So you want to go ahead and treat this, you know, gently and carefully, because sometimes these are very tender and sore right here. Work all the way even around the knee while you're here. Now that I don't have drawings, I can use some oil. So this will make a difference with some of the techniques. So while I am here, this is one of the things I like to do is I put my fingers, both of my hands underneath, and I'm pulling up and just letting the weight of her leg. So I'm working the hamstrings. I'm going to the middle, medial part of the leg and just separating those fibers from the supine position. Makes a difference when you're using the oil. I couldn't use it on the other side because of the drawings, but with this. So this is all I'm doing. It's just going to the middle and pulling up. Just pulling up, separating those fibers. And if you feel any tightness right here in the middle of her biceps femoris and semimembranosus, I can feel some tightness there. I can hold even that trigger point with my fingertips. Remember, no nails, just the finger pads. You can hold it there because I can feel the tightness right there. And I just squat down a little bit more here and hold that because the weight of her leg is putting pressure on that trigger point itself. So again, this is another technique that you can use in the supine position. You can do some friction right here at the insertions. Now another technique that you can do is you can lift up. I'm tucking the sheet in right there. Put their leg on your shoulder and I'm gonna come down the hamstrings. I could do circular motions here with my knuckles. I can kind of use my knuckles here to kind of pin them both against each other and come down. I can do one hand at a time. And I can use my forearm. I can go laterally, or I can go medially. And you can go all the way down to relax your leg. There you go. She was fighting me. So you can go all the way down to the ischial tuberosity. You always want to assist the leg when you bring it back down. You never want to let it flop. But like I said, now you've got techniques from the prone position, from the supine position, and you can also turn them sideline if you'd like. But this is the video for the hamstrings. Make sure you check out the adductors and the quads. We've done the other two already. So make sure you like, that you share, that you leave me a comment. And let me know how you like these videos and what would you like to see next. I appreciate your support. And until the next time.